Well, good afternoon, everybody. As you can see, our aspirations are ambitious. Put simply, by 2018, people in Kent, Surrey and Sussex will be healthier, and when we, our friends or our families, need care, it will be consistently and reliably excellent. So these are our guiding principles. Personalised care according to the individual's needs, choice and control over the person's care, conforming to best practice, prevention better than cure, seeking to reduce inequalities, being treated in the right place at the right time, so localising services whenever possible, but centralising when or where necessary. No existing services will change before new and better services are in place, and services should make best use of the taxpayers' money and be sustainable into the future to enable better patient care. Now, before we go any further, those are our guiding principles, but before I go further, I want to thank Ed, the clinical pathway groups and the chairs, facilitators, all those who worked on them, all the staff, the patients, the voluntary sector, users, carers, members of the public who've been involved in this process of working with the principles, the clinical evidence, working in the groups to say, well, what is it that I want for myself and my friends and my families, and developing our ambition. So your views have been critical to forming the South East Coast Wide Regional Vision. Now, some people may ask why the NHS has to change. We've got more doctors, got more nurses, better facilities, shorter waiting times, better outcomes for patients with cancer, with heart disease than ever before. But as we saw on the film, we want and we need to keep pace with the rapidly changing world, with changing and improved technology, with new clinical evidence, and with the changing needs, desires, expectations of the society in which we now live. We believe that if we empower clinicians, citizens and patients, they, you, we will find the best solutions locally. So there's lots of great work going on already. You've seen some of that in the exhibition. Some of you will have come to our recent Best of Health Awards, which were a fantastic opportunity to see and share in excellence that's taking place across the patch. We've got the Fit for the Future process. We've got many other things going on. So this is about sharing and building on that, getting excellence reliably, consistently, everywhere, and healthier people. So it's a whole system approach, working across boundaries to put the individual at the centre of all we do. So of course it's about leadership, not leaders who are called chief executive or anything else, but the leadership that each and every one of us can give in our own roles, in our own ways, as team leaders, as patient mentors and leaders, as patient coaching our staff, leading and helping, articulating our ambitions. Today's the start rather than the end. We're going to be consulting on this over the summer and then working to support local organisations and communities to take our ambitions forward. I wanted briefly to talk about our pledges to you. These are in addition to the very clear key recommendations you'll find in the documents that have been given to you today for each of the various clinical pathways, for maternity and newborn care, for mental health, for long-term conditions. But from all of that, we've adopted a number of South East Coast-wide pledges. There will be no avoidable hospital-acquired infections. By 2011, there will be no avoidable cases of hospital-acquired MRSA, and there will be less than 2,000 cases of C. difficile. That's less than half today. By 2010, strokes, heart attacks and major injuries will always be treated in specialist centres. We know that's where the best outcomes are achieved. You'll be able to have tests to help diagnose and manage your illness on your local high street or even in your own home. We'll turn the tide on the rising number of obese people. There'll be special programmes to help you cope better with long-term conditions, such as diabetes, and they'll be widely available. Most dying people will be able to die where they prefer, at home, in a hospital, or in a hospice. And we know from our work on end-of-life care, which Ed will talk about later, that that's absolutely not what happens now, although there's some terrific work that goes on. We will reduce the differences in life expectancy seen across the South East Coast, so that all men can expect to live at least 78.6 years, and women 82.5 years. And finally, all patients will hold their own records. We want to know what you think of these. Are they ambitious enough? Will they deliver the care that our patients, you, want for yourselves, your families, your friends, that we need and deserve? So, as I say, today is the next stage of our conversation with the public, with staff, patients, stakeholders, voluntary organisations, local government carers. We want to continue to gather views. I'm proud of what collectively Ed, members of the public, patient-focused groups, members of staff have done so far. I'm determined we can deliver on these pledges and ensure that the South East Coast has healthier people and excellent care for all.